Now, we'd like to take a moment to acknowledge TalentWise for sponsoring today's content and say thank you for your support of this very important topic. But at this time, it's my great honor to introduce you to our special guest presenter, Julia Bell, and tell you just a little bit more about her today. Currently, Julia is the Senior Director of Employment at Cincinnati Children's Hospital Medical Center, a 475-bed pediatric hospital and research foundation. It is currently ranked as the third best pediatric hospital by U.S. News & World Report, along with Parents Magazine. And Julia leads a recruiting team of 40 professionals that source, recruit, hire, and onboard the needed talent to staff an organization that has doubled the number of employees in the past 6 years to over 13,000 employees today. But it's always a pleasure to welcome Julia on and get to work with her again. Julia, thank you so much for being here. Members, at this time, I'm going to go ahead and let Julia take over the presentation.
Okay, thanks, Daniel. I really appreciate the opportunity to talk today about 5 of my organization's recruiting challenges. I'm not suggesting that we only have 5 challenges, but these happen to be 5 for which we've actually found solutions. So in the next 40 to 45 minutes, I'm going to talk about the challenges and our solutions, and hopefully you will hear something that you can take away for your own organizations. To give some context to the organization in which we are using these solutions, I thought I would tell you a little bit more about Cincinnati Children's Hospital Medical Center. Well, obviously, we're a pediatric hospital and a research foundation, and we've been ranked 3rd in pediatrics by U.S. News & World Report in 2014 and for years before that. To give you an idea of the volume of our patients, in 2014, you can change slides here, Daniel. In 2014, we had 1.1 million patient encounters, and we served patient and families from all 50 states and from 57 countries. I realized, Daniel, when you had my bio, it was a little bit dated because now we have 600 registered beds and we're close to 15,000 employees. When I first started working at Cincinnati Children's 15 years ago, there were just about 5,000 employees. So you can see that we've been pretty busy in the HR employment area for the last 15 years. For most of those years, we filled just about 4,000 jobs every year. We recruit locally, regionally, nationally, and sometimes internationally. So on my employment team, as Daniel mentioned before, I have 40+ people on the team filling many positions annually. They most all work virtually. Although most of them live in the Cincinnati area, I do have a recruiter in Indianapolis and I do have a recruiter in New York City. So we recruit virtually, but many of them find their way in the office on occasion at some point in time during the week or during the month. So let's get into the challenges. The first challenge that I'm going to talk about today is the challenge that most of us face, which is the high cost of travel related to interviewing. So of course there are the travel arrangements, the cost of mileage, airfare, the cost of hotels, food, ground transportation, but all of those are not small costs, but we found the real cost to us was in the salaries that were represented on the candidate's itinerary for the day. As an academic healthcare institution, there's a lot of collaborative decision making that goes on, and that carries over to our recruitment process. So many times there will be multiple interviewers lined up on an itinerary for one candidate for a day, and in some cases 2 or 3 days. So if you've ever stopped to do the math on what that actual cost is from a salary perspective, you start to get pretty overwhelmed at the investment your organization makes in recruiting. So when a candidate would arrive after we have pre-screened them on the telephone and feel pretty good about their candidacy, but in the first 30 minutes you realize, or one of the early interviewers realizes, that we will never hire that candidate. That's a lot of money wasted on travel, but it's even more money wasted in terms of salary and the opportunity costs of what else that interviewer could be doing for the day rather than interviewing this candidate. So our solution to this, I'm going to move to the next slide, Dan. was to introduce live video interviewing. And one of the things that we found from this is that we were getting richer data through live video interviewing. And this type of interviewing is where you have PC to PC interviewing. Rather than just telephonic, we could actually see the candidate. We could see things like body language. We could see whether they had good judgment in their background and what they wore to the interview. There's so much richer data that you get from video. So that was one of the things we found. Another thing that we found is that a lot of our candidates are people who are already employed. And they don't necessarily need to talk to us, nor do they need to travel to Cincinnati. And most of them are very busy professionals. So convincing them that they need to take time out of their jobs to come visit us gets a lot more easier when they can see us. We always feel like, maybe we're arrogant here, but we always feel like if we can get in front of a candidate and tell them our story and tell them about Cincinnati Children's mission, we can get them to come talk to us. We found that doing live video interviewing, we can get that opportunity to do that. And candidates are, once they meet us, they hear our stories, they're much more willing to invest their time in coming to Cincinnati and interviewing with us. So part of the live video interviewing was also put in place to respect candidates' time, to respect our hiring managers' time, because we realize that they have other things that are probably more important than interviewing people. And from a recruiter's perspective, they spend a lot less time in going through candidates in person and deal a lot more with dealing with candidates on video. So live video interviewing is one of the things that we can do, but we can also package this to be an on-demand video. And the on-demand video works similarly to the live video in that it's on video, but the questions are packaged ahead of time and they're sent out to the candidate via a link. The candidate can launch the link at any moment and take the interview at 9 in the morning or 9 at night. It doesn't really matter to us. And when the person is finished, we get that back in a link. The recruiter or hiring manager can view the link, the interview at any time at their convenience as well. So we use both of those functionalities with the video interviewing. This slide shows a little bit about what it might look like on any device. And so that's one of the keys to this, is that you can do video interviewing whether live or on demand on any type of device. I oftentimes get asked the question, why not just use Skype? And so there's a number of reasons why Skype did not work for us. First of all, if you go with a provider like we did, you get more reliability. You get security. You get the ability to tape, or record the interview, which Skype does not allow. You can hold on to those interviews and forward them on to others. And like this slide shows, you can actually brand your organization. And so the whole experience becomes much more professional in nature than just trying to do a live Skype interview. So the current vendor that we use allows us a lot of different functionality with their products. So if you're looking at video interviewing, I would recommend that you look at a lot of different vendors and think about vendors who will fit your recruitment process rather than having to change your process to fit the vendor's process. So that was our first challenge. Our second challenge is reference checking. And I know that reference checking for all of you takes a good amount of time. But you don't dare not do it, because you don't want to be accused of wrongly hiring someone without doing due diligence. So I know I'm preaching to the choir here, but there's a lot of telephone tag, a lot of resources tied up in getting references done so that you can make that offer. On top of that, what we have found that most organizations aren't willing to provide anything but dates of employment and position held. So you're doing all of that effort for naught, because the ROI on checking references the old-fashioned way, person to person, just did not work for us. So thinking about this issue, we decided to use an automated reference checking solution. want to advance to the next slide, Daniel. Our vendor, and I've looked at other vendors, so I know they pretty much work similarly, is a vendor that allows my recruiters to spend minutes checking references. And part of that is just the recruiter putting the candidate's solution or contact information directly into the product. The candidate, in turn, puts in the references that he or she wants to use along with their email addresses. The references then get an email from the candidate, or it appears to come from the candidate, requesting that they complete the reference. Once that is completed, it comes back to the recruiter, who can also share it, and it gets uprolled into a pretty cool report that our managers have grown to know and love. What's really great about these references is that the individual who are giving references get the notice that their particular specific reference won't be notable, but it will be pulled up into a summary. So it gives the person giving the reference a feeling of not being exposed when they're providing references on an individual. And we have found that the quality of the information and the candidness of the information that we're getting is very rich. So we have found that this has been an incredible investment for our recruiting team, and I know that if this was ever not available to the recruiters, they would be highly dismayed. The next slide, Daniel, shows that our particular vendor right now gives us sort of a benefit, an extra bonus, in that one, if you're a reference and you're giving a reference on someone, at the end of that event, you get an option to opt in to hear more about our open positions. If you opt in, we collect your data, and then our recruiters can mine that database for other individuals who might be in the same job or might be in the same industry. Because who's going to give a reference but people who are in similar types of jobs? So we found that to be a rich source of candidates for future openings. So I would say if you're looking at a vendor for this type of challenge, you want to look at all of the bells and whistles that the vendor might have available. So our third challenge is nursing turnover. So I'm not sure how everyone else is dealing with this, but I'll describe our challenge is that nurses seem to try out different areas of the medical center. Per policy, they're required to stay in that area for at least 6 months before they can submit a request for transfer to another unit. This has been problematic for us in that we will have a nurse who we spend 6 months training, orienting. We have preceptors who work with nurses on the units. So there's a big investment in nurses. And only to discover 6 months later that all of that time and investment is gone. They're moving to another unit. So what we've decided to do, our solution to this, is to put in a predictive assessment tool on the front end. So this assessment tool helps us to determine if the unit that they're requesting to go to is a good fit for them. So in order to do this, what we have the incumbents in that unit do is we have the incumbents take the assessment. We develop the assessment based on the high performers on that unit, and we use that as our job profile. Anyone who's interested in moving to that unit takes the assessment as well. If their profile is a good fit to the profile that's successful on that unit, we spend our time with those candidates rather than candidates who are lesser fits. And hopefully we will see less turnover and more satisfaction from the nurses on those particular units. One of the things that we hope to see, and I will tell you that we have just launched our very first assessment in our psych unit. So I don't have a lot of data to report on this, although I've seen it in action in other healthcare organizations. We plan to also, we're in the middle of installing it on our HEMOC unit. We have plans to install it on the bone marrow transplant unit, our CICU, and eventually with our advanced practice RNs. If we find that it is successful on those units, we will probably roll it out to other units as well. All right, then our fourth challenge was large volume recruiting. When I talk about large volume recruiting, I'm talking about those positions that are in food service, customer service reps, patient care assistants, medical assistants, those positions that you're going to hire hundreds of people every year. And we have it designed so that we typically have one recruiter who's assigned to certain types of positions. So we have one food service recruiter, for instance, or one recruiter who's filling all patient care assistant positions. And so the volume of those candidates, we don't lack candidate flow in these areas, but what we do lack is the ability to go through hundreds of applications in an easy way. So our solution to that was to institute telephonic automated screening. The way this works is that the candidates sign up for a time to receive a phone call, and the system calls them at that time and goes through a series of questions that we have set up behind the scenes and asks those questions. The candidate responds. The finished interview is sent back to the recruiter via a digital link, and that recruiter can quickly go through those screening questions without having to deal with setting up phone screens, all of the administrative work that goes with that. She can just quickly go through all of the screening, decide who's ready for the next level, and move on from there. This has worked well in our food service department and some of our entry-level positions where individuals may not have computers to do the live video interviewing, or they may not have webcams. So they all have cell phones. So this is a great tool to use. We find it particularly helpful for those positions where they're going to be on the phone as part of their job. This is sort of a really great way to audition them for their role, to hear what their voices, the tone of their voices sound like on the phone. So we've had a lot of great initial success. We just started using that this year, and it's been great. We've been able to really fill positions much more quickly in this area than we were in the past. Okay. And then our final fifth challenge is in regards to our applicant flow. So we wanted more people to come to our website. And we realized that it's a numbers game, and that the more people you come to the website, the better chance you have of people applying, the better chance you have of finding that right person. So one of the things we realized we needed to do is we needed to improve the candidate experience at our Career Center online. Some of the things that we have learned along the way is that 90% of job hunters use search engines. They don't use the big job boards. They go to Google, they go to Yahoo, they go to Bing. 60% of those job hunters who visit career sites don't even apply. They get to the career site and then they just abandon. And that every month there's 1 billion mobile job searches done. So that can tell you pretty much if you don't have a compelling site, you could start losing candidates that you don't want to lose. So what we did is we engaged with a vendor to optimize our job postings. So Daniel, can you move to the next slide? So we've worked in a project so that our job postings are now showing up in the top 3 positions on Google searches, Bing searches, and Yahoo searches. This is important to us because we do hire outside of our local area, and we need people to know we exist. So this has been really important to us. When you get to our site now, we use Taleo as our applicant tracking system. Taleo's got a lot of really great features, but user friendliness is not necessarily one of them. And so what we wanted to allow our candidates to easily get to the jobs they were interested in. So we've put a little bolt-on on the front end of our applicant tracking system so the candidates can easily search our site by keyword, by location, or by job family, and they can get right to the heart of things. And don't mess around with scrolling through a lot of different language or pages that they don't have an interest in. And then the third thing that we did is we wanted to make our career site more accessible by any device, by PC, tablet, or mobile. So now we have that ability to do that because we realize that as the millennial generation is moving into the workforce, and by the way, there are more millennials in the workplace this year than there are baby boomers. So this is something that we probably are a little bit behind the curve on, but we wanted to start getting accessible by any device because it seems like if you're not accessible by phone, that's going to be the go-to device for everything in the future. So the last slide shows a little bit more about some of the other bells and whistles that we got with the vendor that we used for this. So it wasn't just those 3 things I talked about, but it was also about getting a Facebook widget. There was also things that are done around analytics on the back end so that we can actually look at what our traffic looks like and make some decisions on the source of our candidates and what part of the process do they drop out, and that type of analytics that helps us move forward to improve our process. So I feel like I actually raced through that pretty quickly, but hopefully there's some questions that people can ask so we can talk a little bit more in detail about some of these challenges and some of these solutions.
Great. Well, thank you, Julia, for the overview of some of the top challenges out there for healthcare recruitment and some of the technologies that can help manage that task as well. And I know a lot of this applies to industries beyond healthcare, so I think it's applicable across the board in a lot of places. Members, the Q&A is now open, so if you have yet to submit your question, I would encourage you to go ahead and do so now. But maybe off the bat, I was hoping you could talk just a little bit about, from the reference check technology you guys were looking at, how have you found the compliance? Do you guys struggle getting the responses, or have you found it's a lot more beneficial that these messages look like they are coming from the candidate? Can you talk maybe just a little bit more about the experience around that?
Sure. So that is one of the things that we've noticed is that when the references appear to be coming from an individual that they know rather than from an organization, they're much more likely to respond to them more quickly. So our reference checking is typically taking 2 to 3 days rather than a week to 2 weeks. And that's just one of the bonuses we found from using the automated reference checking. Now, during that 2 to 3 days, my recruiters are not doing anything. So it's not like it's 2 weeks of constantly calling people back and reminding them to please do the reference, or we haven't heard your response, would you mind responding? None of that. It's just 2 to 3 days for the individual to get the email, open it, respond back. So it's 2 to 3 days of very little effort on my team's part.
Good. And I had another question here from a member, Lindsay. Lindsay, thank you for the question. Thank you for the engagement today. Hope you're enjoying the presentation. Lindsay's question was, are there ever complications with the validity of references provided? I know I've heard this question on a lot of different reference checking like webinars is, if they're stacking the deck in their favor by asking the people who they know are going to give them a positive review, do we question the validity of the responses that we get?
Yeah, we have had situations where we have doubted the validity. There's a couple things that are built into the product, so it can recognize, I'm not a tech person, so I don't know the correct wording to use here, but it can recognize if a reference is coming back from the same computer. So we do have that, and it flags us, so we know when we need to take a little further look at that and determine whether that's indeed the situation. And also what we do is we put some rules around what we want to see as far as references are concerned. So we require that there be X number of supervisors. We require that they can only use, they can't use personal references, and they must use people who they've worked with. So we do have some rules around how many we need of each. And just like if we were calling someone, if I think the person who asked the question is named Lindsay. If Lindsay was acting as a reference for someone, a professional reference, someone would call her, but they wouldn't really know whether she was a professional reference or just a friend. So the validity can be in question, but it doesn't appear to me to be any more than it was prior to using the automated system.
Thank you. Another question coming in from Liz. Liz, thank you for the question today. Thank you for being here on the webinar. The question was, is the on-demand voice interviewing an audio-only service or video and audio? If video is required, how do you accommodate candidates without video access? And I know you touched on this a little bit, but just in case anybody else missed it, maybe you can run through for us again.
Okay, sure. The on-demand is just like the live video, except we develop questions that are based off of our competencies for the job. And so we have a library of those that we created. Although our vendor provides a library, we decided to use our own because our own are already set up to mimic our competencies, and they're behavior-based. So we pull out the competency questions that might go with a job. We package those up so that when the candidate launches the interview, they get the first question on the screen, they read it, and they respond to it. And sometimes we put time limits. Sometimes we'll say you have 5 minutes to answer the question. Once they answer the question, they click finished. Then the next question appears on the screen. The person responds to it, and so on. So when the interview is over, they click done. It packages it back up, sends it back to the recruiter, and the recruiter can launch it and review it at any time. It does require that the person who's taking the interview have a webcam. If they don't have a webcam, we do two things. We either send them one, which they're relatively cheap, and our vendor provides that service. And you can brand those webcams. So although you're not going to get it back, it still will have your company's name on it. So for whatever that's worth. And then we also have, on occasion, allowed people who live locally to come in and use one of our conference rooms that we set up to do this function. And they can do their on-demand interview here in the office. It kind of defeats the purpose because the recruiter might be in the office on that day, but actually it's a pretty quick process for them to come in, take it, and then leave. So we've used both of those. But what we found is when we have entry level and we just find a lot of people don't have the necessary equipment, then we just use the telephonic, and all they need at that point is just a phone.
Just some follow-up on that. How do the candidates find the candidate experience when they're doing those pre-recorded audio interviews? Is that something that you think is working out in the favor? Is that something you're seeing people enjoying, not enjoying? Where does it stand?
Yeah, that's a good question, Daniel. In fact, we're in our 6th year of doing it, and when we first started doing it, people were sort of like, "What do you want me to do?" And we had a lot of kind of pushback at that point, even from our own managers. But the more that we seem to use it, the more that people are exposed to it, the more comfortable they are with it. And as you would expect, people who are a little older, more my age, tend to often have a lot more confusion about technology, whatever. We happen to use a vendor who, if it's a live interview, will get on the call with the hiring manager or the interviewer and the candidate and make sure everybody feels comfortable, everybody knows how to progress, everybody is comfortable with the technology. So that our vendor actually helps us with that a bit. They also do a customer service survey after each and every interview to get feedback. And I believe that currently we're sitting at about a 96, a positive 96% of people feeling that it was a good experience.
Wow.
Yeah, because we were really concerned about that. And I'm going to be honest, we don't use it for every job. because there are a lot of managers who just aren't comfortable with it. We oftentimes don't use it for physicians because that's a group that tends not to be comfortable with it. Or we don't use it for our bedside nurses because when they interview, they actually do a bit of a shadowing experience along with a nurse on that unit. So we're going to bring them in anyway to do that, so we do the interview at the same time.
Thank you. Another question here from Kristen. Kristen, thank you for listening today. Thank you for the question. And Kristen was asking, how do you utilize social media? Do you guys post your jobs through social media? Do you just post informational info about the facility? Maybe you can talk just a couple of minutes on how you're using social media through the different channels.
So I will be honest, that's probably an area where we have a lot more to learn. We're currently using Facebook. The Medical Center has a Facebook page, and through our web optimization project that was challenge number 5, I believe, we put a jobs widget on the top of our Facebook page. So people who are there on our Facebook page can go there and look at our jobs. We also use LinkedIn. It's probably our #1 source for business positions, and we use that a lot. And so from a social media perspective, we will have people who will like our page and repost our open positions. So from a Facebook perspective, we get that kind of coverage, but we don't use it specifically here in our recruiting department. And I'm sure we have on occasion attempted Twitter or other types of social media, but it's not really something that we're very good at this point.
Kristen, hopefully that helped out. Kristen, ping me or Katrina, we could probably help out too with how to leverage social media, because a lot of times we view it as just a tool of how you can really be engaging candidates. So there's a lot of different things that we do, and we've got a lot of stuff that's up on Recruiting Daily, recruiting blogs that might be helpful to you. But another question here coming in from Ashley. Ashley, thank you for listening. And Ashley was saying, when you're recruiting physicians, are looking at job sites? Do you have any advice on cold calling or any best practices around physician recruiting?
Yeah, physician recruiting is its own little world. And we have 4 people who we use on the team specifically for physician recruiting. A lot of our physician recruiting are actually going to be working as hospitalists or just as physicians, but a whole lot of our other physicians are not only physicians, but they have to be researchers too. So we get into some very niched areas with our physician recruitment. We have a specific website that we use on occasion to tap into databases for physicians. I don't know, the name of the tool that we use is Practice Match, but I know that there are other types of services like them as well. We do a lot of research on my team about where to find certain types of physicians. So we do a lot of Google stringing. It's just amazing how much research the recruiters will do on this. I will tell you that our #1 source of physicians is our other physicians. And so, if you're a physician working in biomedical informatics, you pretty have a small world of other physicians who work in that world, and you all know each other. And oftentimes, those physicians will be our best recruiters for our physician openings.
Actually, hopefully that is helpful to you. I would definitely say also it's similar to tech talent that you want to know definitely a little bit about the person who you're talking to and approach them from the professional and like the personal as well. That knowing a bit of what they're doing as opposed to just a flat-out cold call about the opportunity. You want to know what motivates them, what is interesting to them, what kind of things, career goals do they have, and that way you can kind of, as best you can, leverage the opportunities that are in your company to the interests of that physician.
Yeah, so Daniel, just to add to that, one of the things that we have found that helps us, because we're located in Cincinnati, and for those of you who don't know anything about Cincinnati, it's a Tier 2 city. It's not a sexy city with mountains and seashores and all kinds of great life. It is a Midwest, solid, family-centered city. But what we have found is that we do the best physician recruiting when we find people who originated here. So we oftentimes will go to medical schools' graduation lists to determine, or fellowship lists, or residency list, and try to find people who went to medical school at UC or one at University of Cincinnati or surrounding cities in the Midwest, because most of our physicians who are Midwest originators don't have quite the shock of moving to the Midwest if they've lived here most of their life. It's recruiting from the East or West Coast where we have our biggest problems. So if you think about that in terms of your own physician recruitment, and think about going after people who grew up in your area, you might have a better chance of attracting them to your organizations.
That's a great point. I definitely, anything through the alumni network is probably a great sell. Maybe you get the chance to some of the boomerang hires if you had somebody who was there and has moved on and it's interesting coming back. Could be a great option for you, Ashley. Another question here from Jenny. Jenny, thank you for the question today. And Jenny was asking, do you utilize the predictive talent analytics on PRN employees also? Maybe you could talk a little bit about the assessments that you guys are using, and then are you targeting specific employees on those, and how effective are you finding that, with a little bit of time under your belt on that?
Yeah, we are using that assessment for every status of RN. So whether you're standby or part-time night shift or weekends only, whatever, what we have discovered is a nurse is not a nurse is not a nurse. And a psych nurse profile looks completely different than a CICU nurse profile, which looks completely different than a BMT, a bone marrow transplant nurse. So we're really interested in ensuring that if we're going to hire you for the psych unit, you're going to be more happier if your profile meets what's successful on that unit. And what's successful for a psych nurse at Cincinnati Children's might look different than what's successful for a psych nurse at Texas Children's. So I think every organization, every modality of nursing is different. So we are using it for every nurse who applies. Because there's costs involved, we are starting out with 5 different areas. We just started with psych. Our anticipation is that we will see a dramatic change in turnover on those units. One of the things that we're thinking about doing is, because we're a teaching hospital and we get a lot of nursing students who want to work as PCAs while they're going through school, is to give those student nurses the assessment, so that as a PCA, a student nurse PCA, they're going to be working on the units that they're more wired to be successful on than other units. And so we'll start out early, placing student nurses in the right places. We, obviously are early on our journey with this, but if we have the same kind of success that other organizations have had using it, then we probably will spread it out to all other modalities. And, we might also use it for some entry-level positions as well, where we have high turnover. I know Macy's, which is headquartered in Cincinnati, uses it for every position that they have, and have found success using it, as does Kroger, which is also headquartered in Cincinnati. So it's more than just healthcare using this type of analytic tool. It's all different types of industries.
Great. Thank you, Jenny. Hopefully that helps out. I'm going to shift gears a bit and maybe coming back to the video interviewing, and just ask briefly, you've got the ability to do those live two-way interviews and also those kind of recorded interviews. Are you finding one type is more useful in certain situations than the other, or how are you deploying the 2 different types?
Well, we're leaving it up to the recruiter to design whatever the search is going to look like. But typically, we'll use on demand when there's a large volume of candidates, and we need to get that volume down to a reasonable amount, that we either then follow up with in-person interviews, or maybe we do another live PC to PC interview. So every situation is different, and it really depends on the hiring manager, how fast the search has to go, all kinds of things. But typically on demand is going to be used for situations where there's a lot of candidates. A lot of it has to do with the comfort level of the hiring manager and what they would like to see done. But sometimes the recruiters don't even involve the hiring manager on the on-demand. They use it just to pre-screen and sort of get people in the queue so that there's candidates available when the position opens up. Hopefully that answered your question.
Yes, it was good. Thank you. I guess another question coming from the flip side of the social media, we're always looking at what's going on with candidates and how we think they're going to perform, but they're obviously doing a bit of research on us as well and using those social media channels. I know, Julia, you and I have talked before about taking control of like the Glassdoor entry for your company. Maybe you can talk a little bit about Cincinnati Children's experience around that avenue?
So can you ask your question another way, because I'm not sure.
Sure. Just ways that you guys maybe are using, kind of how you're branding yourself with, I know you have that Facebook page, so you can kind of have some engagement with candidates, but I know you and I were talking about having the Glassdoor entry for your company and seeing what people are saying, that it's like the kind of poor man's engagement survey of what's going on with my employees right now. And candidates are obviously looking at this and seeing what the scoop is and what it's going to be like to work there. Can you talk maybe just a little bit about what you guys are doing to kind of engage candidates in that arena?
Well, this is that gotcha question, Daniel. So I will tell you that we are probably more concerned with our current employees and how they feel about their employee experience. So right now we're doing quarterly pulse surveys to randomly selected employees to get a better feel for how the market might be shifting in regards to how they're feeling about their employment here and whether they're looking at other places of employment and that kind of thing. But the other thing that we've noticed is that depending on the category of employee, we have different types of branding that we need to communicate. So locally, we have a very strong brand. Everybody knows we exist, and we have a very strong applicant flow, probably too strong because we deal with a lot of volume. Where we struggle, our biggest struggle in recruiting is recruiting experienced pediatric nurses. And there's a yin and a yang to that, in that we do not have any competition in Cincinnati. We are the only pediatric game in town, which is great from a business perspective. It's terrible for experienced nurses. We either have to grow our own pediatric nurses, or we have to convince them to move to Cincinnati. We don't have a lot of trouble convincing advanced practice nurses and management nurses to come to Cincinnati, but one of the things that we've discovered is that bedside nurses don't relocate. It's almost impossible unless they're coming with their spouse. So we struggle with that. We don't know what the solution to that is. If anyone has that solution, I'd be happy to listen. So our branding to nurses is a little different than how we might brand to entry level. And for nurses, it's about the kind of experiences you're going to have here that you're not going to have anywhere else because of our investment in research and technology, some of the cutting edge things that we treat here, some of the cutting edge surgeries that we do and the transplants. So we brand differently to that. As far as our researchers and physicians, they're more interested in the branding of the research foundation. What kind of research is being done here and how can they be part of that? Who are the renowned researchers that they get to work with? So they're not so much interested in the city as they are interested in the work that's being done within the academic institution. So I don't know that I've answered your question, but branding for us is a little complicated because it depends on who our audience is.
No, man, that was good. You coming down from a marketing standpoint of segmenting the audience and knowing who you're going to be going after. So right. I found it helpful. Hopefully our members out there found it helpful too. If you guys would like some clarification on that, feel free to shoot another question into the question and answer pane, and we'll kind of keep chatting about that if you're interested. But got another question here from Mark. Mark, thank you for listening today. Thank you for the question. And his question was, have you tried group interviews for massive recruitment processes, maybe some of the really large volume things? Is that something you guys have ever entertained, or I'd imagine it needs a bit of infrastructure in order to make that work?
We have done group interviews, And we have done them at usually the professional to management level, and have done a lot of presentations where candidates come in and present to a group. So yeah, that is used, I wouldn't say often, but it's used enough that I can say that we've used it with pretty much confidence. I will tell you that it's highly stressful to the candidates because they tell us that. And I don't blame them. I think that would be a very stressful situation. But a lot of our positions are such that people who are interviewing for them are going to be doing a lot of presentations or have done a lot of presentations in their professional lives. So for them, it's part and parcel of, this is previews of coming attractions. So oftentimes we will ask them to come in and present to a group because we want to see their presentation style as well as their content knowledge. So yeah, we've done that a lot, but I hate to say this, but it's in addition to the one-on-one interviews that we have already done. And a lot of that is our culture and this collaborative decision-making culture where people feel like they have to have their hands on every candidate, like they have to have a voice on every candidate. And yes, it is part of our culture, and yes, it does make recruiting cycle much longer than it actually really needs to be. But at this point, our culture is eating time to fill.
Mm-hmm. No, good points. It's kind of looking at both sides of that there. Well, members, we have wrapped up our content for today. I don't want to shut anybody down, so if you guys are interested in continuing the discussion over on Twitter, you can use that hashtag #OurDaily, and you can join me over there. Also, the guys over at TalentWise and the team here at Recruiting Daily, we worked on a white paper entitled Healthcare Recruitment Challenges and How to Overcome Them. Also a resource available on the site here, so if you'd like to go deeper into some of the other challenges that we didn't touch on the webinar, you definitely have that as a resource as well. You'll be free to download and take a peek through. I do want to say one more big thank you to Julia for coming on board and sharing perspective and her experience at one of our top hospitals in the country. So Julia, thank you so much.
Thanks, Daniel. I really enjoyed it, and I appreciate your invitation to do so.
Always fun to get to work with you. I appreciate you taking the time out of the day and sharing all of that with our members. Thank you to TalentWise for sponsoring today's content. Of course, members, biggest thank you all goes out to all of you. You guys are the reason that we're doing this. We want to make sure we can solve the challenges, be there for conversation, talk about what you're dealing with, and the best way to kind of get over those challenges and find solutions to those. So thank you for spending that hour with us today. We should have the on-demand version of today's content ready for you within about 48 hours. So go back to the page where you registered, and like I said, in about 48 hours, we'll have the on-demand video of today's webinar up, and we'll have that deck up there too, PDF, so you guys can kind of take back through if there were questions you had about the content or you had anything that was still pending in there. And definitely feel free to reach out to me at any point. You find me on Twitter at Daniel Trending, or you can find me here Recruiting Daily at Daniel@recruitingdaily.com. But again, thank you to everybody. Have a great remainder of your day out there, and I hope to see you on another webinar soon. Bye for now.